We're Sentia Health. We are in the business of streamlining and automating processes, and we have even automated the production of new software. Usually, we talk about the state of healthcare and health insurance in the United States, and today is a little different. Today, we are going to discuss how to build the electronic medical record system that will make this whole thing work, why it is better and how it benefits the practice, the practitioner, and the patient. I'll be back after the presentation to discuss our conclusions and what this all means to you.
Over the past few months, we at Sentia have been advocating to streamline and automate health insurance. We have stated that this is accomplished through providing the electronic medical record system, EMR, to the practice or hospital. That is only viable if we can provide an EMR that is at least as good as what is available now. We think we can do that better, and we are going to present our case today. In subsequent installments in this series, we will explore the technology, the security and interoperability, but today we will focus on what this system does, not how. Since all our processes are automated, we can charge $10 per month to the patient plus the actual cost of the risk, eliminating about 50% of the cost of traditional insurance, plus another 25% for lowering the incidence of chronic disease. The base functionality of the EMR is broken down into 8 categories. The EMR itself: integrated health and wellness, integrated email, self-scheduling, questionnaires, reporting, compliance, DICOM viewer and growth charts. Our EMR is based around the patient. The first order of business is to select a patient. This is fairly self-explanatory, but also of note that we use a multi-tenant database. This means that there is one record for every patient, no more and no less, so you can search for and find patients that have never been to your practice before. Next, we can select patients that match the criteria we typed in the previous step. Our test subject, John T. Public, is selected. We select Encounters to see his records. Things to note here: there is a list of Jack's health risk assessments at the top for reference. The list of actual visits is below. Selecting one of them will return this. Apologies for the small size, there is a lot of information here. First is a detail of the measurements detailing health, such as height, weight, and blood pressure. Aberrations from normal are highlighted according to their abnormality in yellow or red. Next, we have 4 sections that comprise a SOAP note: subjective, objective, assessment, and plan. Section to document the patient encounter. These are not typed. They are picked for ease of entry and accuracy. It is actually faster to search and pick than to type, and far more accurate. Under that is the note itself. This is populated from the choices you made in the 4 sections above it, and again, no typing is required. Let's click the Add button in the first section and see what happens. This is the UNLS selection tool. You can search the SNOMED CT. Discussions about this are for a subsequent article in this series, according to concept type. As you type, a write-ahead drop-down will populate. Notice here that the search term was not found, so we will click Populate to find out how to spell what we were looking for. Notice that the spelling was corrected and the thing we wanted is at the top of our list. We can also modify this finding by clicking on the ellipses to the right of the Modified Value list box. This allows the practitioner to modify the selected value and then add it to the SOAP note. The resulting generated SOAP note looks like this. These are all discrete values picked out of a database, so they are 100% searchable, and we can create aggregate reports and queries that search for these values or combinations of values. That means that we can pick a differential diagnosis and get a list of associated symptoms that others have found in the past, or give a list of symptoms and get diagnoses that match. This makes Dr. House look pretty silly tottering around on his cane and thinking hard enough to make smoke come out his ears. Next, the practitioner can type in free-form notes to remind themselves and others of relevant information outside the main SOAP note. For the main medical record, that is really it. Again, this is based on the UNLS that is updated twice per year and ingested into our database. It is suitable for any medical eventuality, and in fact, unlike ICD and CPT codes, was designed to document patient encounters in their entirety. Additionally, not pictured, we have a survey tool that we will integrate with the EMR that will allow a practice to build a questionnaire to request additional information that is attached to the record. These are not UNL's values, just questions the practice wants to ask at a given time in the process, allowing them to modify the EMR to suit their own needs. The practice writes the questions and the system saves the answers. More on this in the questionnaire section of this video. One of our ambulatory surgical centers uses this survey to record blood pressure, heart rate, etc. when the patient is handed off from surgery to recovery. 84% of all spending on healthcare in the US is made on avoidable, behavior-based chronic disease. That means that in 2024, of the $4.7 trillion we paid for healthcare, $3.95 trillion was spent on available disease. Americans are about one-third more likely than other developed countries, OECD, to have avoidable disease. The OECD average mortality due to chronic avoidable disease is 225. The US average is 336 per 100,000. If we get Americans healthy, at least to the point where everyone else is, we could save $1.27 trillion. At Sentia, we have developed a system that tells you what is wrong with you, shows you how you compare with acceptable values, and then tells you what to do to correct the problem. If the patient logs in and even looks at the prescribed patient education, he or she gets a small discount. If they see how to correct identified problems, they get a large discount. Let's look at our test patient's health risk assessment, the individual health analysis, and the prescribed patient education. These are the history and behavioral questions we need to construct a health risk assessment. Included is a mental health assessment on page 2 that asks general mental health questions and can be used to identify at-risk patients. Arranging for care for patients with less than optimal mental health will reduce violence and suicide. Finally, the regular checkup, a regular patient encounter filled out by clinical staff. Note the previous sections are filled out by the patient anywhere in the world that has an internet connection. Now all we need to do is report back to the patient, as we discussed, so they will know what is wrong and what to do about it. Here is the printable individual health risk assessment. There are several things to note here. First is our total risk count. This is the number of results that are out of normal range that the patient needs to focus on. This is a printable report available online as well, that gives the patient an overall view of what needs to be done. Second, note the actual age of the patient and the body age. This is derived from the Youth, Sorensen, Overgaard, Peterson equation and is intended to scare the patient into moving around a little bit. On your screen now is a copy of some of our patient education that is automatically prescribed when the lab results come in. Things to notice. The temperature gauge shows how far out of normal your results are. The range for normal readings. A problem statement and a solution statement that details what to do about your condition. Finally, a link to further education on a free site, in this case, webmd.com, for more information. We have contracted with Crames to provide patient education materials for the patient in the case of things we don't have written documentation for ourselves. This is our plan to save the $1.27 trillion we talked about earlier. We quite literally bribe the patient to get up and move around with things like the body age, the temperature gauge, and some cash to lower the cost of their individual insurance. You can't send sensitive medical information over email. Because of that, we have developed an integrated email system to transfer this information in a more secure manner. It works exactly like you'd think and is fairly easy to show. This is intuitive to use and works as you'd expect. Scheduling is available to the practitioner, the staff, and the patient to make a new appointment from the Patient Encounters page in a menu at the top, as seen on your screen currently. Clicking the View Times button results in the Details page where any of the above people can schedule an appointment. This is based on the practitioner's schedule, so we don't have appointments when that person isn't at the clinic or hospital. Showing the scheduling administration is beyond the scope of this presentation, but it is there, and it works. Normally, when you visit the doctor, you have to sit in the waiting room with a ream of paper and a pen filling out the same information over and over. Name, address, phone, date of birth, and then have to actually fill out the forms that have been run through the copier 10,000 times and are barely legible. Now, all that is gone. We provide the practice or hospital a way to design and build their own questionnaires with no programming and no additional assistance at all. Type the question, select the answer type, and click Publish, and your survey is live on the internet, ready to be assigned to a patient or to an encounter. Further, the questionnaire is viewable as a printable report, suitable to give to the patient or save in a file cabinet. On your screen is a test questionnaire commissioned by an MRI practice. We've mentioned the reporting tool several times. Let's dig into some details on what it is and how it works. Currently, the reports are only available to design by the development team. We have several available, and you have already seen a few examples. The value this brings is mostly formatting. We run the data extraction for the report and pass it in as a data table that is consumed and displayed by the report itself. The report is then savable as Excel, Word, PDF, or any of a number of other formats, or simply printed out. Here is an example of our fully automated population health report, page 3. Just click the button and open the report. Notice the built-in table of limits and the bar chart showing the number in each category of this particular population. This is a 27-page report generated in a few seconds, and a test copy is available on request. Compliance, in this case, measures what the patient is doing to maintain his or her health. While this is on an individual level, and thus can't be shown here, and is only used in other calculations, like discounts for healthy living, we do have a population compliance report that details how individuals are tracking in health over time and against only themselves. This is a copy of the first page of a compliance report pulled for one of our clients, and one of their clients, not too long ago. Inherent in every record is an image and growth chart viewer. This is separate from the DICOM viewer. Below that is for sharing images, though the patient and anyone with access to the records can view these. And the growth chart example.
In previous articles, we have shown a way to save 50% now and an additional 25% eventually of the cost of health insurance using our own EMR. This is that EMR. This is the sine qua non for our new plan. We welcome your feedback in our efforts at continuous improvement. We have shown a way to make patients healthier by educating them on the consequences of their behavior, and a way to capitalize on that to the sum of $1.2 trillion, or about 25%. If we add that to the process automation savings of our solution, we are in the ballpark of more than 75% savings in total. We already have the best doctors and the best equipment. We just need to implement the above detailed framework to give them all the tools necessary for success. We have this system in prototype now, fully functioning. Contact us here or on our site, and we will be happy to provide a demonstration of the fully functional prototype. If you liked what you heard, please like and subscribe, click on the notification icon, subscribe to our newsletter, and follow us on all our social media and blog sites. You can read the text version of this presentation at sentiahealth.substack.com. We have built a comprehensive health information system to keep the patient healthy and on the right track with the ability to incentivize healthy living. Implementing this system should be fairly simple and will completely revolutionize the way healthcare is paid for, saving countless lives. We have shown a way to use this system to make the best healthcare system in the world, also the most efficacious and the most affordable.